Welcome today, everyone. My name is Madeline Stiers. I am the Chief Clinical Officer here at the Hope and Healing Center. Thanks for being with us today. Very much appreciate it. Like I said, if you'd like to leave your cameras on, you're more than welcome to. If you'd like to leave them off, please feel free to do that as well. Just please make sure that you are muted so we can get through today without any audio distractions. We know sometimes that happens. If you have questions throughout the presentation, please post them in the chat. Alpha, one of my team members, will be collecting those questions, and we'll spend some time at the end answering them. So yeah, feel free to pop any questions that you have in the chat. I appreciate some dialogue at the end. If we have questions, hopefully I'll be able to answer them. So before we jump into today's topic, I want to tell you a little bit about the Hope and Healing Center and Institute. If you're not familiar, we are a faith-based mental health nonprofit. We do a variety of different things, one of them being offering educational programs with information that cover the span of mental health to caregiving, aging, and resiliency, substance use. We also have a full clinic here where we offer free mental health therapy, psychiatry, and case management. We have trainings, a training department, so our Gateway to Hope University. We have trainings that we offer to faith communities, schools, and workplaces that educate people on what mental illness is, what mental health is, and how to help them set people up with care for their mental health. And then we also do research. So we have a few of us here doing research, and we'll talk a little bit about some of the research today. But yeah, that is a brief overview. I'll talk a little bit more about some of the services that we have that might be helpful for if you are a provider in the area or work at a nonprofit or working with women. We'll talk at the end a little bit about some of the services that we have here in the Houston area that might be helpful for referrals. So today we are going to be talking about interpersonal violence and spirituality in women. My computer is frozen. So let's see. There we go. So I'm going to start the conversation by going through some definitions, just talking about what interpersonal violence is, stress, trauma, concepts like that. Talk about the importance a little bit. Why is this an area of importance, not only in research, but in practice as well. We'll talk about protective factors when we're working with women who have experienced violence. And then we'll talk a little bit about what post-traumatic growth is and how those are connected. We'll then talk about some recent research that's gone on related to religion and spirituality with women who have experienced an interpersonal violence. And then at the end, we'll talk about what offering support to women looks like and how you can integrate religion and spirituality into that based on some of the most recent research findings. Right, so like I said, before jumping into all of the nitty-gritty, I wanted to go over some definitions. So let's talk about what stress is, right? If we're talking about interpersonal trauma, interpersonal violence, having a basic understanding of what stress is important. So stress is a state of worry or mental tension caused by a difficult situation. Stress is something that everyone experiences across the board, right? It can be viewed on a hypothetical spectrum with tedious everyday, like day-to-day stressors on one end and potentially traumatic events on the other end. So stress is not something that is, it fluctuates. The amount of stress that we have based on certain situation, it's not always singular. It can fluctuate from day-to-day stressors all the way across up to potential, interpersonal violence or traumatic experiences as well. On that spectrum sits major life events. So on one end, the lower end of stress, we have day-to-day stressors like a car accident, child rearing, work tasks, and then towards the middle, we have major life events, which are situations that are associated with some degree to psychological harm or unpleasantness, challenges that result from significant changes in a person's life or circumstances. So that might be a divorce or a change in work or being let go from a job, the loss of a loved one. All of those might be considered major life events. The stress associated with them is a little bit more intense or at a higher level. Someone might experience stress at a higher level with major life events as opposed to day-to-day stressors. And then on the far end, we have potentially traumatic events, which is something exceedingly shocking that overwhelms a person and really limits their ability to respond to that situation, but then also limits them to their ability to continue to function on a day-to-day basis in the manner that they had been. A potentially traumatic event can occur whether or not their life or their physical safety is at risk. But really the thing to think about with potentially traumatic events is that it's really going to have a hindrance on that person's ability to navigate the stress that is a result of the situation or the events, and hinder their ability to continue day-to-day functioning, and whatever that might be: school, work, home life, relationships, all of those things. So what makes something a potentially traumatic event versus a traumatic event? So their stress response. Someone who experiences, so if you're in the Houston area, which we are today here, all of Houston and a lot of other areas experienced Hurricane Harvey, right? We all experienced the same event. And for some people, their response to that was they had a stress response. They had a potentially traumatic response to it. Some people who experienced very similar situation across Houston did not have that physiological response to it. So what makes something a potentially traumatic event versus a traumatic event is that person's response to the situation, or their stress response, how their body responds, how their mind is responding to that event. Part of this is also based on their interpretation of the events. So not everyone who lived in Houston experienced the same level of flooding or damage. And so their interpretation of the event may have been slightly different or drastically different than others across the Houston area. So a person's interpretation of the event also helps to differentiate between a potentially traumatic event and traumatic event. A diagnosis also, so if someone has received a diagnosis from a mental health care provider that they have PTSD, we would likely say that that was a traumatic event, that event did cause a traumatic stress response in that person, whereas same situation might not cause a traumatic stress response in a person. And then some also, what I don't have listed here is something that would make it a traumatic event is if your life was in danger. Now, whether you have a stress response or that results in some sort of mental health challenges, having your life threatened or your physical safety threatened or in harm's way could push it more towards it being a traumatic event as opposed to a potentially traumatic event. Okay, so interpersonal violence. So when we think about trauma, there's disaster trauma, Hurricane Harvey, what I just mentioned. There's combat trauma. There is a whole wide range of things. Interpersonal violence is a specific form of traumatic experience. So it can be termed as violence between individuals that is inflicted by a person or a group, including an intimate partner, who may or may not know another person. So physical or sexual assault by a person that you know or by a person that you are not familiar with would be considered interpersonal violence. A physical assault with a weapon, all of these things would be considered interpersonal. Interpersonal meaning between people, right? Violence that occurs between people. So interpersonal violence that we're going to talk about today, the research that I go into later and some of the concepts that I'm talking about is really going to be specific to women. So this is my area of research, is interpersonal violence in women and how that relates to mental health outcomes and religion and spirituality. But that does not mean to say that interpersonal violence does not happen for men in any of the ways listed here on this slide, but also if we think about combat, that is also considered interpersonal violence, right? It's violence happening between people. It is a salient type of trauma that impacts people worldwide. It does not discriminate in any way, shape, or form. So it's something to think about, is that this is not specific or unique to women, but it does affect women in a way that it might not affect men on the same scale that it might affect men as well. So the importance of this, global prevalence rates of IPV, IPV is interpersonal violence, in women is extremely high. So 736 million women worldwide, or 1 in 3 women, will experience a physical or sexual violence at some point in their life. And that, I believe, is from age 15 and older. So that is not even including, that's in adulthood. We're not even talking about childhood violence. So it is extremely prevalent, not just here in the US, but also across the globe. Trauma, as we know, has been linked to poorer mental health outcomes. As many of you today here might be providers or individuals who work with people who have experienced some sort of trauma. We see that day to day in the work that we do. So it's really important that we understand the different areas that can connect with interpersonal trauma, and how we can help navigate those people through our systems and our agencies to help better their mental health status and their outcomes. Women are particularly vulnerable to interpersonal violence outside of combat, which men are more exposed to. But rates of PTSD related to IPV in women are twofold than those in men. So women who experience any sort of trauma are much more likely to develop PTSD than men. PTSD in women also tends to exemplify more severe symptoms and higher rates of comorbidity, so substance use or depression, anxiety, OCD, other mental health issues. And additionally, PTSD is more likely to develop when interpersonal violence is reoccurring. So whether that violence is happening in the home or in a place where this woman is continuing to be exposed to this sort of violence. So women are particularly vulnerable to interpersonal violence, but also in the development of PTSD and other mental health diagnoses as it relates to trauma response. There's a lack of research related to interpersonal violence, mental health, and religion and spirituality. All three of those independent. There is a wealth of literature on those, but as we look at women who have experienced interpersonal violence and their mental health outcomes, and how religion and spirituality can be a factor in, how is that factored in? What does that look like in these outcomes? There's limited research on that. And then there's just a consensus on the need for practical application of integrating religion and spirituality into practice, therapy, groups, any sort of support that women are seeking. We know that religion and spirituality has proven beneficial for women who have experienced an interpersonal violence, yet the research is limited on how do we do that in a way that is effective, and what does that actually look like in practice. Excuse me. Okay, so as we talk about trauma, experiencing interpersonal violence, I think it's important to touch on post-traumatic growth as well. So post-traumatic growth is what happens post trauma, usually after, whether it's reoccurring, once the reoccurring trauma stops, or after a single event. Post-traumatic growth is the perceived benefits or changes that emerge from traumatic events. So it's associated with internal, psychological, and existential struggles that occur following the traumatic event. So I want to be clear, post-traumatic growth doesn't mean you have a traumatic event or a traumatic experience, and then all of a sudden you're growing and there's this wonderful thing that happens immediately following. No, oftentimes, as you see in that first bullet point, there's struggle. There's challenges, relationally, mental health, physically, all of those, existentially, psychologically, spiritually, that emerge as a result of the trauma. But if you are effective in working through those struggles or navigating those in a way, post-traumatic growth can occur. So IPV exposed women who experience lower levels of post-traumatic growth report more negative psychological outcomes. So women, obviously, who may not be taking the steps to address or seek support and help for them after exposure, are less likely to experience post-traumatic growth, and they're going to experience higher levels of depression, anxiety, psychological outcomes. What post-traumatic growth might look like is experiencing gratitude about life, finding meaningful relationships that are healthy relationships. They might be able to identify personal strengths and have a higher sense of self-esteem coming out of the experience. They'll be able to identify a purpose in their life, the possibilities that they have. After a trauma, oftentimes a person's worldview can be completely shattered. And so post-traumatic growth is the rebuilding of that kind of shattered worldview, moving forward into kind of like a healthier place that where you're able to continue and move forward and function. But also that last piece is women often gain a greater sense of spirituality or religiousness following the event. I apologize, I'm talking my voice away, so I'm a bit scratchy. Oops. Going the wrong way. There we go. So protective factors, what are some things that could help you all as potential providers or mental health care professionals in understanding what a client's strengths might be, where their deficits might be, that would help you work through treatment planning or providing an intervention for women who might show up in your office who have been exposed to some sort of interpersonal violence or traumatic event. So we find in research that identifying your clients or your peers' level of resiliency is important. Individuals who, prior to an event or following the traumatic event, have a higher level of resiliency are going to be protected against some of the more commonly thought of negative outcomes of trauma. So mental health, negative mental health outcomes, things along those lines, depression, anxiety, post-traumatic stress disorder, things like that. So identifying a person's level of resiliency will be helpful. Where's their social support? What does their social support look like? Do they have a healthy group of people around them? Is their family around? What is their family saying following the events? Are they being shamed or told that this happened because of them, or it was their fault, or do they have people really in their corner supporting them in a way that that they might need in the aftermath of a PTE? Another protective factor is education. So individuals who have higher levels of education are going to be protected against some of the negative outcomes of experiencing a PTE. So understanding where your clients or your coworkers or peers level of education will be helpful. oops, I'm going backwards. Developing healthy coping behaviors. So whether if a person was raised in an environment where they were able to establish healthy coping mechanisms and healthy coping behaviors, they're going to be protected against some of those negative factors. Identifying if the person doesn't have healthy coping skills, and then helping them to put those in place is going to be beneficial. And then religion and spirituality. So that's really what we're going to focus on today. We're going to be talking about two concepts within religion and spirituality that you can begin to talk to your clients about. I'm going to look at some research there and how these could be protective factors when working with individuals who have, women particularly, who have experienced interpersonal violence. So as we know, there are aspects of RS, which is religion and spirituality, that are thought to be central to post-traumatic growth. It's been suggested that having a religious or spiritual system in place provides a framework to individuals who have experienced trauma to constructively and deliberately process through the events, while also helping to rebuild maybe their shattered worldview and create meaning from the traumatic event. Finding meaning in the event is oftentimes done through a person's religious or spiritual system, their higher power, whatever that might look like. Religion and spirituality might function also as a way to process the event through God. So, you know, being able to turn over some of that to God and not feel like they have to bear the weight of these events entirely on their own, depending on what their religious beliefs are. So as opposed to internalizing the event and connecting it with their identity, with who they are, and that shame and that guilt that oftentimes follows being placed solely on them without any higher power. Individuals who do have a higher power and believe in God are able to process through the identity of God and their identity as a child of God. And two of the concepts that we're going to talk about today are God images and religious coping. So those are the two of the areas in the research that we've recently concluded. And so I'm going to explain a little bit what that looks like, and then we'll talk about how you can use those in practice. So God image is a person's internalized sense of God. It's not a picture of God. It's not, you know, a visualization necessarily. It's not like, what does this picture, a photograph look like? It's not what it is. It's a person's sense of God, what they believe God might be like. And we oftentimes use human traits to personify what God might be. The God image that we used is Frosch and Bader's God image categories. So we have authoritative, benevolent, critical, and distant God. It's easy to remember, A, B, C, D. All of these sit on two scales, so an engagement scale and a judgment scale. So the authoritative God has higher judgment, higher engagement. You see that in the top right quadrant of this, this graphic on the screen. So what that means is a person who might fall into an authoritative God image sees God present in their day-to-day. They might see them as actively engaging in the world, but there's also a higher level of judgment. So while they might be actively engaged and actively present, that person with that God image feels that God has a higher level of judgment. So they might think, well, I did something wrong, so God sent this to me, right? So that might be a thought that's associated with an authoritative God. Benevolent God, again, they have higher level of engagement. So someone with a benevolent God image thinks God is present, engaging in their day-to-day, but is not as judgmental. So they might think, you know, God is here doing good things. You know, I know that maybe that we're sinners and we're doing this and that, but I don't feel that judgment from him. So they have higher engagement, lower judgment. Critical God, higher judgment, lower engagement. So they may fear that God is judging them from afar. Essentially, they're not as engaged in the day-to-day life, but they do feel the higher level of judgment. That's their perception or their internalized sense of God. And then a distant God is low judgment and low engagement. So hands off, low judgment. I've told y'all this is what God wants, but the judgment isn't high and the day-to-day engagement isn't there either. And then religious coping. So there's various ways of thinking about religious coping, but we're going to talk about Pargament's religious coping styles. And that is positive religious coping and negative religious coping. But essentially, religious coping is a person's effort to understand and deal with life stressors transcendentally as it relates to the sacred or the divine. Positive religious coping includes methods that access spiritual support, positive reframing of stressors, and a sense of spiritual connectedness. Whereas negative religious coping, which could also be considered religious or spiritual struggles, include difficulties or upset with the divine or with God, negative interpersonal encounters with other religious individuals, or negative intrapersonal beliefs, so often related to shame or doubt that might be related to themselves or their concept of religion and spirituality. Most people have a little bit of both of these. So understanding, your clients, I don't think I have this in here. So when we send out these PowerPoint slides at the end of the presentation, I will also be sure to include the citations for where you can find more information on God image as well as religious coping, because these are both measures that you can use, scales that you can provide with your clients that will give you an answer of which kind of God image they have and how is this person faring with religious coping. Do they have more positive or the more negative religious coping? So I can send that information out. I don't think I have it on these slides just yet, but I will be sure to include that. And then before we jump into some of the research, I wanted to talk about mental health, right? So we're talking about women who have experienced interpersonal violence. We've just gone over two of the concepts of religion and spirituality, God image and religious coping. Now let's talk about psychological outcomes or mental health. So current research related to interpersonal violence is limited as it relates to religion and spirituality and psychological outcomes, right? Independently, those three things, there is lots of information on, lots of research around, but how those three overlap and what that looks like is very limited. So with more specificity, when we talk about religion and spirituality, it's even more limited on what the research says about God images as following interpersonal violence and religious coping styles. And how they influence a person's mental health or their psychological outcomes. So interest in religion and spirituality in the context of trauma has grown in the last few decades, but like I said, the research is currently limited, and given the inadequacy of the literature that covers these few topics, there's limited information on psychotherapeutic, evidence-based interventions or psychotherapeutic treatment for women who have experienced interpersonal violence and how to integrate religion and spirituality into that. Obviously, there's a wealth of evidence-based trauma treatments, but how to integrate religion and spirituality in an evidence-based way is limited. And this leaves mental health providers and clients, with working to ascertain what the course of treatment is going to look like in a way that is what the client may be asking for. As we know, research shows that many individuals that show up for mental health treatment, whether it's trauma related or not, do want to be asked about their mental health. They do want to be asked about their religious beliefs, and they do oftentimes find it helpful to have those discussions in therapy sessions. So this lack of information here regarding women who have experienced interpersonal violence and how religion and spirituality could potentially be helpful in the treatment is really doing a disservice to not only those women, but to our providers who are working to serve those women as well. excuse me. So in a recent study that myself and my colleagues conducted, we started in 2020, height of the pandemic. It was a little bit hectic, but we did it. We launched an exploratory sequential mixed methods study to further understand how these two concepts, God image and religious coping, were associated with women who'd experienced IPV and how it related to psychological outcomes. So today I'm just going to be talking in kind of broad terms about the research. It was not a correlational study. It was, so I can't say this causes this and this causes this. There's no causation for me to talk about today. But it's really just, it was exploratory to say like, hey, there's no research out here about this. What can we find? Where are there some connections, and what's some information that we can start to launch via future research that might give us a bit more information. So we started with interviews. We talked to women who had reported a history of interpersonal violence, talked about their religious or spiritual beliefs in relation to the event, and then also in relation to their mental health. And then the second phase of the study was a national survey that went out to about, I think, 1,600 women across the US to explore psychological outcomes. So they took, here, I think I'm on the next page. So they took the God questionnaire, which just gave us some basic background information. They took, the God questionnaire is the measure that does the God image. DOS-21, depression, anxiety, stress scale, and then the brief RCOPE, which is the shortened version of the religious coping scale, Parkinson's religious coping scale. That went out to about 1,200 women. And so from the interviews, they were about an hour and a half each interview. We created the national survey that went out. There were some measures on there. There were some additional questions that were created following the interviews. And the hope was that we would be able to capture not just women in a specific area, but women across the US get broad sweep of information and really understand how they were how their views of God and how their religious coping style might have impacted their depression, anxiety, and stress ratings. We also had a comparison group. So we had women who had experienced interpersonal violence, and then we had women who reported no history of that violence, which is a difficult feat, and we were very lucky to be able to do that. From the interviews, we were able to narrow it down from, you'll see on the image here. So we coded, so the interviews were conducted, they were transcribed, coded into some broad categories, 9 categories there. And then narrowed down even more into themes, and then essentially the essence of the experience. So the essence was termed relationally reflective. So this is the intentional reflection of the relationships to God, people, and themselves following trauma and a shattered worldview. Analyzing the relationships in the context of their own trauma to understand how this may have been altered following the trauma. So really, essentially what the women had reported feeling a lack of connection to God initially, a lack of connection to other people or even to themselves, given a shattered worldview that oftentimes follows a potentially traumatic event. Really what we found is that through the use of reaching out for support, whether that be faith community or a mental health care professional, they were able to process through and reflect on all of those relationships. So relationship to self, relationship to God, and relationship to people, which for the most part helped them navigate and come out with some level of what I would call post-traumatic growth, although we did not measure post-traumatic growth in these women, but they were able to find some resolve and some healing following the event using reflection on these different types of relationships. So that was pretty cool to see. And we know that for you all who might be working with women or anybody who's experienced trauma, we know that trauma can have extremely negative effects on a person's interpersonal relationships, whether the trauma were in childhood or in adulthood. People are believed or not believed. There's so many negative impacts on relationships following trauma. So to see that these women were coming out of this and having to reflect intentionally and on the different relationships that were important in their life. They're the people here on earth with themselves and with God. Really kind of speaks to the importance of community and relationship in trauma populations, which we talked about as a protective factor earlier today. So it's all kind of, we see the connections, it's making sense, right? The national survey, where are we at with time? Okay. So with the national survey, we sought to explore the psychological outcomes or the mental health outcomes and religious coping styles of women who experienced interpersonal violence as it relates to their God image. So with the interviews, we were just solely interviewing them. We had a set of questions that we ran through, but the national survey, we did not actually speak to these women. They were crowdsourced through an agency across the US. And really what we found with religious coping was that individuals who had a critical God image, if I come here, critical God image is high judgment, low engagement, regardless of trauma. So I said we had women who had experienced trauma and not. So individuals with a critical God image, or women with a critical God image, regardless of trauma, had the highest negative religious coping and the second lowest positive religious coping. Individuals with an authoritarian God image, which if we come here, is higher engagement, high judgment. So both of these fall on the high judgment scale, had the highest positive religious coping. So even though they were high in judgment, they were high in engagement. So individuals who think God is highly engaged have higher levels of positive religious coping. And again, both of those are regardless of trauma. So women who did experience trauma and women who did not experience interpersonal violence. Obviously, but it's important to report, is that the interpersonal violence group, so the women who have a history of that, reported across the board higher levels of negative religious coping than women who reported no history of interpersonal violence. So as you see women in your office or family or friends who have experienced interpersonal violence that might start to struggle with their religious coping or their faith beliefs, this validates that women who have experienced an interpersonal violence are going to have higher levels of negative religious coping, which again is distrust in the divine, conflict with other religious peoples, a whole array of things. It's not just their internal beliefs, right? So as we talk about mental health outcomes, specifically depression, anxiety, and stress, you can see it broken across the different God images here. There was an interaction effect for anxiety and stress across authoritative God, benevolent God, and distant God. So the critical God reported high anxiety and stress regardless of exposure. So women who have experienced an interpersonal violence with anxiety and stress across those three, AG, BG, DG, we're going to experience higher levels of anxiety and stress, whereas individuals or women with critical God image report higher anxiety and stress regardless of exposure. So women who were in the interpersonal violence group as well as the no history of interpersonal violence group. And then depression was approaching significance in a lot of these different categories. We don't have it on the image there, but anxiety and stress were really the two mental health outcomes that we saw in all four of the different God image types. Well, okay, so before I jump into that, so we've now talked about the religious coping, mental health outcomes, and God image in this research. So this study that was just recently done in the last few years. So what implications for future research does this say? One of the things to think about that we thought a lot about throughout this study was what other concepts or terms within religion and spirituality might be important to integrate into practice, which would then mean we need to be researching them. So we talked about God image, we talked about religious coping, but what other concepts might a person come in wanting to discuss that are outside of those two? So this kind of, maybe it's relationships or interpretation of scripture. What does all of that look like, and how is that valuable in practice when working with women who have experienced interpersonal violence? This research also identified a need for more case control and longitudinal studies. So case control meaning individuals who did and did not report a history, and then longitudinal long-term, right? Because we did a single point in time study where we asked women, had you experienced this? We weren't able to follow their potential changes in God image and religious coping from prior to the event or after the event, or even after the event at any point in time beyond that. It was at a single point in time that we asked the questions and information. So longitudinal studies or experimental studies, really, where someone might be getting treatment. So future research might include might address the impact of re-victimization or multiple exposures on religious and spirituality concepts and mental health. So our study did not ask how many times the person had experienced it. It was rather whether they had or had not. Longitudinal studies I mentioned, and then the role of God image or other religious coping or religious and spiritual coping as a mediator or moderator to psychological outcomes. So is one mediating or moderating the impact of the other. Implications for practice. So we've talked a lot about this. This study and the research and this conversation today really highlights the religious and spiritual distress that women face following interpersonal violence. We know that mental health outcomes are not always great following trauma, but I think we as providers can forget to address and even just broach the subject of religion and spirituality. We know that interpersonal violence can happen in a religious context or religious setting. So not everyone is going to be open to that discussion, but for a lot of people they may be. And we had a lot of women eager to engage in this research. So there's something going on there that needs to be addressed, not just in research, but in practice as well. So like I said, this emphasizes the necessity of a practitioner's inclusion of and sensitivity towards religion and spirituality. Not necessarily proselytizing or sharing your own personal beliefs, but really helping identify where a woman is at in her religious or spiritual journey following trauma, and how you might utilize that in a way that is going to be helpful and beneficial for them as opposed to harmful. We really talked about two concepts that may or may not be new to you today that you can take and implement in your practice. And like I said, when I send out these slides today, I'll make sure to give the citation to where you can go find these two measures. They're pretty short, as long as you get the short version of them, and you can start using those in practice yourself to just give you a little bit more information about what's going on in a religious or spiritual sense with your clients. It could really help you work to integrate religion and spirituality, as long as your client's open to that. And again, this all lays the foundation for future research that might lead to the development of more educational conversations like the one that you're here today with me on, training, what does this actually look like in practice? And then ultimately, hopefully, the development or creation of a religious or spiritually focused trauma treatment, whether that's just a general trauma treatment or one specifically for women who have experienced an interpersonal violence. So that is hopefully some of the takeaways that you've gotten today, some information on the research that we did. Yeah, I appreciate you all being here. We've got about